back in 2017, so it was 72,000 people who died of the overdose, and it's approximately we are losing 200 people every day. So it is a national emergency.
In general, there is stigma associated with substance use disorders historically that we're still fighting. Still, a lot of individuals believe that this is a moral choice as opposed to a brain disease. Most common misperception that we hear from our patients and otherwise is that by prescribing buprenorphine or methadone, we are just replacing one addiction with another. But we disagree. This is not true. There is a huge difference between being physically dependent on a prescribed medication in a controlled setting versus substance use disorder, which is a brain disease where a primitive part of your brain, reward center, is hijacked, is dysfunctional to the point that drug becomes the biggest motivation in person's life and takes person's life. And MAT can bring the person back to normal functioning.
So there is a different philosophy behind these medications. Some of them, they completely block the receptors in the brain. Some of them partially block. But these medications, they help with the cravings and prevent death and prevent the relapse. People might abuse buprenorphine as well, so they can take it more than prescribed, and they can inject it too. So to prevent that, they add naloxone in the compound, so that if a person tries to inject, they will go into withdrawal.
Medical specialties that are ideal for having these certifications, psychiatry being one, myself. Obstetrics and gynecology would be another, because we have a lot of pregnant females who are dependent on these substances and they need specialized care. Pediatricians, it would be ideal to get involved more of, because this is starting in adolescence, and we want to make sure that we are taking care of this at the roots of it starting.
This message has been brought to you by the Pennsylvania Medical Society, building healthy Pennsylvania communities.